Hi, my name is Rosie Morante. I'm a second-year nursing student, and today I'm going to be with Mr. Mancini giving an injection, one subcutaneous injection, and the other is an intramuscular injection. So first, I'm just going to get started by, there's a laptop here checking my MAR to make sure all the orders are correct. So I see here that the patient's name is Mario Mancini. He's allergic to codeine, so I'll make sure that nothing has that I'm giving him. And the meta orders are as follows. So it's 5,000 units subcutaneous every 12 hours of heparin and 1 milligram intramuscular every 4 hours PRN, so as needed, of Haldol. So I'm going to begin to prepare the meds. So it's 2 medications, and I don't have gloves right now, or else I would be wearing them on top of my hand hygiene. So I'm just going to get started. So the supplies I need after a full cup of coffee in the morning is the medication. So there's 2 vials here, and they're each labeled. We're gonna pretend like they're right. And then we have 2 needles here, 2 syringes, I should say. And one is 3 milliliters, and the other one is 1 milliliters, because after the dosage calculations, that's the size that's appropriate. As well as for the Haldol, we're gonna need a 22 to 23 gauge needle, and for the heparin, about a 25 gauge needle, because there's a difference in the size. The larger you get in the numbers, the smaller the diameter size. And then I just have some alcohol swabs to clean the tops of the lids, as well as the patient's arm before I inject them. Okay, so I'm just gonna prepare the injections, and we're gonna start with some hand hygiene. So I'm just rubbing it in here. I'm gonna pretend like I did it for at least 30 seconds. Okay, we're gonna start off with the Haldol first. So if I do my medication calculation, the order says, Haldol, 1 milligram intramuscular. So I'm gonna just do 1 milligram divided by 4 milligrams, which is the dosage strength, times 2 milliliters, and that leaves us with 0.5 milliliters to administer. So for this one, we're going to be using the 1 milliliter syringe, so that it's just easier to gauge out. Okay, I'm just going to flip this off, and then since this is a sterile procedure and the cap is not considered sterile, it's very important that we use alcohol to clean it, and I'm going to let it dry just to mitigate the risk of it possibly entering the bloodstream, which of course we don't want. If I could only get it out, okay. All right, I forgot to mention as well before that along with my supplies, I also have a garbage bag to throw things out, as well as a sharps container, which is here. So I'll leave that here for now. And then I'm just gonna throw this, also I have my name tag, in the garbage. And I also have blunt tip needles just to pierce through the vial, and then I'm going to switch the needle onto the syringe that I need. Okay, so I'm just going to get the needle ready. Okay, so I'm just going to put the blunt tip needle onto the syringe here, and I actually just want to make sure that I have the 1 milliliter syringe, because again, we're going to be drawing 0.5 milliliters. Okay. Oh. Okay, so now I have the blunt tip needle on, and I'm gonna just draw back 5 milliliters of air, because what I'm gonna be doing next is trying to create kind of like a suction. So I'm just gonna pierce into the vial, like so, inject the air on in, and then I'm gonna flip the vial and draw back 5 milliliters of the Haldol. Additionally, I'm going to be drawing back a little bit more because there are some air bubbles that I'm going to have to get out, and then I'm going to prime the needle. So I'm just going to flick the air bubbles out here. Okay. And it's about ready to go. Sorry, I also just wanted to mention that I accidentally said 5 milliliters. I meant 0.5 milliliters is in here. And I'm just going to, okay, so sorry about that. I'm just going to be recapping this, and then later on I'll be putting on the new syringe, or the new needle, just because I'm getting it prepared for now. So I'm just going to recap it safely, make sure I don't hurt myself. And then I'm just going to be writing the label. So I'm going to be writing the patient's name, as well as the dose, and the date as well as the time. Okay. And then I'm just gonna pretend that this is a much nicer label, and I'm gonna tape it on to the Haldol. And now that's ready, and I'm gonna get the second one ready as well. So we have another needle here. This one is a 3 milliliter syringe, and it's 25 gauge because it's subcutaneous for the heparin order. And the order is for 5,000 units, which would translate to 1 milliliter after I did the calculation earlier. Okay. So again, have the 3 milliliter syringe, and I'm just going to uncap this. And again, I'm just going to use an alcohol swab to swab the top there because it's not sterile. I'm going to just be putting that in the garbage. Okay. Just allow it to dry for a few seconds. I'm just going to prime the syringe with the blunt needle to pierce through, ensuring not to hurt myself, hopefully. All right. And then I'm going to be drawing back 1 milliliter of air this time. Again, the purpose is just to create a little bit of suction. Okay. Then I'm going to be injecting the air, drawing it back. There we go. That was a nice suction. All right. And then I'm just going to flick the air bubbles out again. Prime it. Oops. And then I'm going to recap it and label it just like I did earlier. This time, this is the heparin, subcutaneous. I'll do the dose, the route, the name of the patient, the date, and the time. Okay. Okay, so now it's labeled appropriately, and I'm off to the patient's arm. Okay, so now I'm just going to be giving Mr. Mancini the Haldol, but first I'm going to be doing my hand hygiene again. Okay, and I just have all of my supplies ready as well as the sharps container. So I'm just going to introduce myself. Hi, Mr. Mancini. Today I'm going to be giving you your medication, which consists of heparin as well as Haldol. Do you understand how these work?
Yeah, I do.
Okay, that's good to know. If you have any questions, let me know. Okay. Shouldn't hurt very much. I'm just going to inject it here on your deltoid, and let me know if you feel any tenderness or anything like that, okay?
Okay.
Okay. So first, I'm going to start off with the 0.5 is the Haldol, and this is the intramuscular injection. So first, I'm just going to be removing the blunt needle, because obviously that would hurt a lot to go in. I'm going to be recapping it. And as you can see, this actually has a lure lock for safety, so I'll be using that probably after. Okay. Ooh. Technical difficulties. Okay, so we have the needle here. It's primed, it's ready, and there's no air bubbles that I can see. It's the right dosage. Everything's good. I explained the procedure to the patient, and I'm going to be going in at about a 90-degree angle, injecting it quickly but not too quick, and then leaving it for a few seconds just to make sure all the medication has actually gone in. Okay, so I'm going to be doing it at a 20-degree angle, and good.
That didn't hurt that much.
Yeah, and then I'm going to leave it and then give her a gauze pad to apply pressure for a few minutes. Okay. And then I'm simply going to just recap this here, and then I'm going to be putting this needle in the sharps compartment because it's considered hazardous now. Okay? We're going to pretend like a few minutes has passed, and I'm going to be giving the heparin now, which is a subcutaneous injection, and this time it's the 1 milliliter syringe. So I'm just going to be removing the blunt force needle. Oops. There we go. And then putting on the lure lock needle. 25 gauge for this one because it is subcutaneous, of course. Putting that down. And then just removing this cap. Just a little tinier. Yes. Okay, so the same procedure as last time. I'm going to be going in at a 90-degree angle. Shouldn't hurt. If it does, let me know and we'll fix it for you.
Okay. So do I have enough skin just down here for you to use?
It looks good, and how you ensure this is by pinching the skin so that there's enough tissue there. Usually that works best. So like if it's on the stomach as well, you can just give it a nice pinch. Thank you. I will pinch it.
Okay.
Okay, 90 degrees. Okay, and I'm just gonna, again, give you this to hold there for a few minutes. Let me know if there's any bleeding or pain, please.
Okay.
Okay. Thank you. And then I'm gonna just put the luer lock in place and in the sharps container. Okay, so are you feeling okay?
I'm feeling pretty good, yeah.
No pain?
No pain.
All right,
No,
let me
you did
know
a
if you
good
need
job.
anything at all, and I'll be back to discuss with you in a few hours, okay?
Thank you.
And then after I'm away from the patient, I'm just gonna document what I did, the procedure, how it went, the dosage, the medications that were administered, which is important because if I didn't document this, then no one would know that I gave the medications, and then there could be a risk of a medication error. Anyways, thank you for learning with me how to give injections, and I hope you enjoyed. Thanks, Teresa.